Hi, I'm Dr. Tom Bain. This is Dr. Matt Vogt. We are the co-founders of OsteoSmart. We're here today to talk to you about bone health. So if you or a loved one has been diagnosed with osteopenia or osteoporosis, you want to pay close attention. So what inspired OsteoSmart?
I had one patient that, this was very early on, that had bilateral femur fractures, and she was a retired nurse. And this patient at that point in time, she was in her late 70s. And she was wheelchair dependent because of her femur fractures that wouldn't heal. And come to find out, these femur fractures were from the result of taking medication that was supposed to treat her osteoporosis. And in her situation, in this situation, there are specific fracture patterns that go along with certain medications. They're helped to promote bone health, but in some cases, it made her bones more brittle.
And so that's standard of care, right?
That is standard of care.
So what we have is a metabolic disorder that clearly starts earlier in life, but because the bones are so dense, the loss of bone doesn't really show up till later in life. What I'm understanding is if we could run the echolight and get a good test score for them when they're 30, use that to compare future echolights to them. That's an ideal situation.
In my opinion, yes. But whether it's 30, whether it's 40, whether it's 50,
right.
65 is too late.
Right.
Again, we should be doing the baseline test earlier and then comparing patients to themselves. And that's not standard medical care. That's just our opinion here at OsteoSmart.
Logic. Seems like that's logical.
About 4 years ago, I was approached by a good friend who, in his travels in Europe, came across a device that was used an ultra weak magnetic field. And when it was used to treat a patient, it helped to improve circulation and helped with healing. And what they found was it actually helped with bone healing. So patients that had fractures that from trauma or for whatever reason that just didn't heal, took longer than 6 months to heal, with this magnetic field therapy, these fractures were healing when treated for a number of treatments. So then it was used for bone health, for treating osteoporosis. And so what they found there was that using this specific magnetic field, it helped to improve bone density.
And so they proved that in the clinical trial?
They did do a clinical trial and showed that the T-score improved after 12 treatments. So the 12 twice weekly treatments for 6 weeks.
And that's lymphotherapy.
Right. Yeah.
Would it be accurate to say that the lympha is the non-pharmaceutical treatment for the osteoporotic or osteopenic patient?
Our alternative to the pharmaceutical component is using the lympha ultra weak magnetic field therapy. And essentially what that's been shown to do is to improve bone density. So we'll treat the patient twice a week for 6 weeks, and then we'll retest in 6 months. During this time, the patient will have the patient doing load-bearing exercise as well. But we'll retest in 6 months and make sure that they're moving forward, making progress, not just maintaining, but actually improving their T-scores that represent the bone density. This device was made in Italy. That's where it's been studied the most. And their recommendation is that if you fall into the osteoporosis category, you'll repeat this once a year. If you fall into the osteopenia category, the expectation is that you should repeat it every other year. Along those lines, if you're in a situation where you're just really making progress with strengthening with your load-bearing exercise program, then maybe you don't need to repeat it. Right. It would be icing on the cake at that point.